Good evening. I'm Chris Charbonneau. I'm the CEO of Planned Parenthood of the Great Northwest. We almost never talk about sex at these things, so that happy task falls to me. You might have heard of us for some of the things that we do, but today I'm here to talk to you about an at-home self-screening test for gonorrhea and chlamydia. I want to tell you the story of Steve and Jennifer. They're a young couple who've been trying really hard to get pregnant for a couple of years, and they've been unsuccessful doing so, and they come to realize that Jennifer's tubes are completely scarred shut as a result of a chlamydial infection that she did not know she had. This young couple are infertile, and they are devastated. It's imperative that we do something about these diseases. Pelvic inflammatory disease and infertility and blindness are three major things that happen when you're infected with these diseases. And that absolutely is unsustainable for a community like ours. If we were all in this room, 25-year-old or less, what do we think our chances would be that we would have caught sight of one or both of these diseases in our time so far? If you've guessed 50%, you'd be accurate. 50% is awful. And you're saying to yourself, seriously, gonorrhea, Chris? Did we not solve that in World War II? Well, they were great posters, but let me tell you, warning people away from women who look like Mamie Eisenhower is not an epidemiological strategy. We can do better, and we will. These are equal opportunity diseases looking for hosts. Do not be a host. How this system is going to work is that you're going to use your laptop, your phone, your tablet, whatever you choose. You're going to give us some medical information. We're going to send you in inconspicuous packaging a test. You're going to swab yourself in the privacy of your own home. You're going to mail it back to us. We're going to test it in our lab, and we're going to send you your cure in the mail. This is an end-to-end system, from diagnosis through treatment through cure, and nobody else is doing this. Why don't people just walk into our health centers and get this done? Well, let me tell you, they're stigmatized. We're talking about sexually transmitted infection here. They're fearful about what we have to do with them. They are living too far away from the health centers, and they haven't had the tools till now to make this an efficient process. 75% of the time, these diseases are asymptomatic. People don't know they have them, but they do know. They've taken a chance. And it's in that teachable moment we need to get to them so that we can make this testing happen and we can find out and test and cure. 6 million people a month show up on Planned Parenthood online, and 1.8 million of them have questions about whether or not they could have a sexually transmitted infection. I'm showing you now a map of the United States, the lower 48. It's red because these are the chlamydial prevalence rates across the United States. The redder the map, the worse it is. You can also see the blue dots that show you where the health centers are, where you can actually get cured from these diseases. You can see the further the distance, the more likely the red spots, and so we need to solve this geographical problem. These are headlines from 2 weeks ago in our local newspaper. Here in Washington State, our gonorrhea rate has increased 34% in this year. We have the knowledge and the decades of experience to deal with this on our team. You can see behind me the launch team just for the pilot project and the vast experience these folks have. This is going to be legal and it's going to be private. The mailers, as I said, are discreet, and we're going to begin this in Washington and Minnesota and then roll this out to Alaska, Idaho, and then California, where due to the huge numbers of people we expect to use this testing system, this breaks even. I'm not commenting on California, just the way it is. Good news, too. Insurance is going to pay starting January 1 with no deductibles and no co-pays for these kinds of tests as a part of the refurbished system. This is going to cost us $3 million to launch. We have raised $2.5 million of it nationwide. We're raising $500,000 of it locally. And we are asking SVP for $25,000 to help us with a user testing system to be sure that our cure rate is what we need it to be. We're joining our audience, asking our audience to join in the invitation to help push us over our goal. We're going to market this to the 6 million people that we see online. That's inexpensive for us to do. And there's so many possibilities for the future of this technology. The return on investment is huge. Preventing a single case of pelvic inflammatory disease saves us $150,000. And preventing a single case of blindness of a baby who doesn't need to have it is priceless. It's a unique solution, and we invite all of you to come with us and be partners in this new way of doing healthcare. Thank you so much for the opportunity to speak to you.